Okay, Cassie, today we're going to talk about proper toothbrushing. I noticed in your mouth you've got a little bit of recession where the gums have pulled up a little bit, and you've got a little bit of wear on the roots of your teeth, and I think maybe you might be brushing too hard. So there's several things. First of all, you always want to use a soft or extra soft toothbrush whenever you're brushing your teeth. And if your toothbrush ever looks like you stepped on it, you are brushing way too hard, okay? So we always want to brush very carefully and gently. And I use the analogy, if you had a very expensive sports car, you would not brush it or clean it with a Brillo pad and Comet, because that would just destroy the paint and destroy the expensive car. You would do wax on, wax off in the shade with a little chamois cloth and make sure you baby that paint. And that's how we want to clean our teeth. Slowly and carefully with a soft toothbrush. So the area we care about is right where the gum and the tooth touch each other, this gum line here. And you want to put the toothbrush slightly angled up so that the bristles just get right under the gum line there, and little teeny circle to cover one or two teeth, and then just move over, little teeny circle. You can also do a little vibrating back and forth if that's an easier motion, but we do not want this. We don't want the scrubbing. This would be great if our teeth were perfectly flat, but they're not. They're rounded. And when you do this, the toothbrush bounces on the outside of each of the tooth surfaces and doesn't clean interproximate or in between. And then the plaque accumulates and the gums start bleeding. And that, of course, is a sign of early gum disease. So anytime your gums bleed when you brush or floss, it's a sign of gum disease and they need more attention. So you always want to use a soft toothbrush. And the reason for that is the medium toothbrush or hard is just too abrasive. And one of two things happen. Either you clean the gum line and you scratch it all up so it becomes very irritated, or you inadvertently lower it to stay away from the gum because it irritates the gums. And of course then the plaque is sitting on the gums. So a nice soft or extra soft toothbrush is always what we recommend to all of our patients, okay? Very good.